Welcome to the Richmond Center for Christian Study. The mission of the Richmond Study Center is to bring gospel transformation to individuals and communities within the greater Richmond area by fostering serious consideration and discussion of biblical worldview and how that worldview speaks to every area of life and culture. For more information about the Richmond Center for Christian Study, visit us on the web at richmondstudycenter.org. This is the second in a three-part video series entitled Reforming the Healthcare System: How a Biblical Worldview Bears on the Current National Debate. In this segment, the panel will share their thoughts of how a biblical worldview speaks to the question of healthcare reform while giving the medical and social insights needed to gain a greater understanding of the challenge before us. Our panel includes Dr. Michael Murchie, Assistant Medical Director of Crossover Clinic in Richmond; Dr. Donald R. Stern, Richmond Area Health Director; and Dr. Terrell Wade, Board Member of the Richmond Center for Christian Study and a retired family physician.
He completed his medical degree at the Medical College of Virginia in 2005, went through an internal medicine residency at St. Vincent's Hospital in Indianapolis, and was board certified in internal medicine in 2008. Dr. Murchie has been working at the Crossover Clinic since 2008 and is currently the Assistant Medical Director there. He's had a number of service activities in Richmond and in his previous Indianapolis years, a couple of medical relief mission trips to Russia. And I think we can safely say that Michael has lots of experience with the medically needy and the uninsured patients that he's hoping to share with us tonight. Underpinning all of this is his commitment to the Lord and his family. He has a wife, Melissa, and 3 children. The youngest is 7 months old. So we're grateful that they let him out tonight.
Thank you. Thank you all for having me here. Thank you for being here. I actually hadn't heard of the the Richmond Center for Christian Study until I was asked to speak here, and I was very excited to learn more about it. I really believe firmly in Christians applying biblical principles, not just to personal spiritual growth, but also to how we interact with each other and how society should govern itself. As Terrell said, everything is the Lord's, and it's not just about me and God. It's about applying biblical principles for life more generally. I'm just going to raise this up a little bit. I do have a little bit of a cold, so let me know if I'm starting to squeak or if you can't hear me. So Crossover Ministry, I'd like to see a show of hands actually. How many people have heard of Crossover Ministry? So most people in the room. It's a free clinic that is in Richmond. The goal of it is to serve the poor and those without health insurance in the name of Jesus Christ. It was founded about 26 years ago. Actually, one of the founders is here tonight. Dr. Colin Rivers is here. And it started as a storefront church. A clinic in a storefront church in very humble beginnings, and has grown to the point where in the past year we saw about 4,600 patients. And out of those patients, there were about 23,000 visits that have come through our doors throughout the course of the year. So it's amazing what God has done, and the faithfulness of so many people that have come together to support this ministry. The basic things that we do as a ministry, the most common thing that we have is clinics. We have 3 physical clinics throughout the city, one on the south side of Richmond, one in the west end of Richmond, and then another at the intersection of Jeff Davis and Chippenham. And the clinics are full-service clinics. They are open throughout the week. We have night hours as well, and then we also have Saturday morning mission trips. I was in med school just a few years ago, and my experience at Crossover as a medical student was something that God used to change my view of medicine and change how I wanted to handle my career there. I saw Christians coming together across boundaries of economics, across boundaries of race, and taking their shared faith and serving together. Just an amazing ministry. The programs also include something called the Lay Health Promoter Program, which is where we go into local churches and teach healthy living. There's not the physicians on staff, but there's a group of nurses and volunteers that actually go in and lead a biblically based course for people that they then graduate from and then themselves become lay health promoters in their churches. So it's a really neat program. Crossover itself is put together by a partnership or funded by a partnership of just about everybody in the Richmond community. It's amazing how many people have given to us over the years and continue to. Large portion is individual giving. Churches give to us. Hospital systems. My salary is half paid for by Bon Secours, half by HCA. It's one of the few things they've ever done together, I think, and I think it's a great thing that they're doing. We also receive a very small amount of state funding, but for the most part, we're privately funded. Eligibility to become a patient at Crossover, you do actually have to show that you are in need, and we think that's a very important part of what we do. To be a patient, you have to have no insurance at all, and you have to be 200% of the federal poverty level or below. So that's a basic introduction to who we are. The next question, I think, is why are we doing what we're doing? And I think I'm going to start with kind of the scriptural basis for that, which Terrell has already done a beautiful job of, I believe, is I think what the principles that she brought out apply very closely to what we're doing. I think one thing that we are is very gospel-centered. The gospel states that we're sinful, we're broken, we need redemption, we can only get that through Christ. And then in knowing Christ, we are restored into relationship with him, and we're made new, and healing personally, spiritually, eternally can occur. And I think that's pretty much what we do. Living in a sinful world, one of the results of that is disease. And as healthcare providers, we're able to work on restoring that level of brokenness. I think beyond that, we are all sinful people, and as sinful people, we make bad choices, and we do things that harm our own health. And as a clinic, we're able to be a place where people can come in and have redemption in that aspect as well. And beyond just redemption, beyond just getting a Band-Aid or getting a pill, but also empowering to work on the tough work of changing one's life, which is very hard. One verse that has meant a lot to me as far as why I do what I do is 1 John 3:16 through 18. And it's pretty simple. It says, "This is how we know what love is. Jesus Christ laid down his life for us, and we ought to lay down our lives for our brothers." And then it says, "Dear children, let us not love with words or tongue, but with actions and in truth." So I think the model is there. What Jesus did is something that we want to replicate as Christians, as well as a ministry at Crossover. The other portion of why we exist is that there's great need. And I think there's always been great need. Obviously, there were many poor people in Jesus' time. There have always been poor people, and there always will be. No matter what system is devised, there will be need. There's no perfect system in spite of what politicians promise. There's no system that will not have need. And at Crossover, we see that going forward. No matter what, there's going to be need. We're going to find the people that are left behind in a system, that are vulnerable, and seek to serve them with the love of Christ. Another specific aspect of need is that in the state of Virginia, as well as in many states, Medicaid doesn't truly cover all of the poor. I used to think that. I thought, poor people have insurance, they all get Medicaid, right? And that's just not true. The cost of health insurance, et cetera, means that people that we maybe even wouldn't consider poor can't get Medicaid.